Hi guys, I'm Sam. I'm a first year med student studying at med school in Australia, and you're watching From Ed to Med. So it's been a while since the last video. There's lots of reasons for that. But to summarise, basically I've been hella busy with med school. I've also had a job for the last couple of weeks, which has been 30 hours a week, marking NAPLAN tests. In addition to that, I've also taken on some extra research work at the hospital, so that's awesome opportunity, but it does, again, take some time. And a whole heap of other things have come up, which means I haven't been able to talk to you guys for ages. So here it is, another episode of From Ed to Med, and we're going to talk today about what I've been doing and what I've been learning in the last couple of weeks. I had a request from one of my viewers to do this, so thank you very much for that. Again, if you can think of anything else you'd like to know about med school in Australia, please do ask, and I'll do my best to address them in a video. In the last 10 weeks since the holidays, we've been doing a heck of a lot of stuff. So what I'm going to do in this video is give you a brief overview of some of the concepts we've been talking about. I'm not going to go into too much detail, that's not what the channel's about, but if you want any more information on any of these topics, please send a comment below and I'll do my best to link you to some great information, great places to go to see it. So one of the first topics we looked at was hemostasis, so the blood stopping, basically. Hemostasis. We looked at the clotting cascade, we looked at drugs like thrombolytics to, stop it happening or to break clots up. We looked at edema, we looked at deep vein thrombosis, and we looked at varicose veins. So within hemostasis, there's a lot of topics around that. We looked at the immune system and the immune response, so that means both the adaptive and the innate immune systems, the humoral response, so looking into antibodies, the structure of antibodies and what they actually do in our body, different types of antibodies. We've looked at the inflammatory response, and we've also looked at the complement response, so that was within all under the idea of immunity. We looked at anemias, different types of anemia, different classifications of anemia. We looked at the red blood cells as physically under microscopes. We've looked at different pathologies that you can get. We looked at the genetic inheritance of various anemias, and that led us on to talking about genetics in general. We also looked at components of blood and blood transfusions. A big part of our time was also spent looking at cancer, neoplasms, different benign and malignant growths and how they come about, the different systems that our bodies have to try and stop the growth, and what happens when they go wrong. So genes like the P53 gene, the BRCA gene, all those sorts of things that can go wrong, turn into oncogenes, and really cause or help the spread of cancer. We looked at how cancer can actually adapt, and the way it, it's really fascinating the way it can adapt to our body and the way it wants to spread itself and the mechanism it has to do that. So it's really fascinating, if kind of really brutal enemy, I guess. So we looked at its grading and staging, as well as, different types of cancers as well. We looked at that under the microscope in pathology labs too. We had a brief look at wound healing and infection, by first primary intention and secondary intention. We looked at the things that can go wrong in wound healing, things that can cause it to go longer, things that can cause things like keloid scarring. We looked at bacteria and various infections that can also delay wound healing. In addition to that, we've also looked at hypersensitivity reactions. So what happens with our antibodies when they go crazy and they react to something like pollen in a really, really bad way and cause an inflammatory response that can sometimes be life-threatening. So we looked at the idea of atopy and atopic reactions, and we looked at what drugs we would administer to a patient who was going through an anaphylactic reaction. Then we spent a bit of time looking at the menstrual cycle and pregnancy. We touched on very basically embryology too. So that was some really intense sort of stuff. And I'm fascinated at how complex the female reproductive system is. There's just a lot going on there that us guys do just not have to worry about at all, thankfully. Remaining below the belt, we also had a look at STIs, urinary tract infections, and all the sort of things that can go wrong down there. That included a whole session of interviewing simulated patients and getting comfortable talking about sex and sexual topics and how to approach them. Now through this we've also had pathology labs, and we've also looked into microbiology quite a bit. So we've looked at various different types of bacteria, and we're just starting to look at viruses. In terms of pharmacology, we've studied a lot of main classes of drugs, and while we don't have to know things like exact dosages yet, or a lot of detail, which will come later, we do have to know the main mechanisms of actions of quite a few of the drugs. So we looked into a lot of detail on antibiotics, different types, different classes, different lines of defense of antibiotics, whether they're narrow spectrum or broad spectrum, what we would use in which situations for various infections, and of course we looked into the proper prescribing of antibiotics, what they call antimicrobial stewardship, so making sure that we know when to use them and the instructions to give patients to follow through with the entire treatment, because it's very important that we don't breed antibiotic resistance, which is becoming a massive issue. And they gave us a fun fact that the WHO says within 100 years all forms of tuberculosis are going to be multi-drug resistant. So unless we come up with some interesting ways of solving that, that's going to be awesome. Although we've also been touching on virology, as I may have mentioned before, and they have some really good ideas about bacteriophages and actually viruses that attack or go into and enter bacteria instead of human cells. So maybe, hopefully, fingers crossed, otherwise, great times. We also looked into things like opioids, antidotes to opioids. We looked into antiplatelet drugs, nitrovasodilators, thrombolytics, things like warfarin, heparin. We looked into vaccination a little bit, and antivirals. So the case we're looking at the moment is talking about herpes and acyclovir. We also did a little bit of workshops on injections, so we actually had to learn how to properly give an injection to a patient. So that was fun. So that was a very brief overview of some of the topics we've looked at over the last 10 weeks. It's been very jam-packed, and it's only going to get a little bit busier because exams are coming up. In 2 weeks' time, we've got our major exams for the end of semester. Looking forward to it. I'm not kind of stressed about it yet. Obviously I'm spending my time making a video here instead of studying right now, but I'm sure it'll be fine. So a lot of revision in the next couple of weeks, and we'll see how we go with that. Guys, if you've got any questions, or you'd like any of these topics to be discussed in a bit more detail, or you thought of something that I haven't said before that you'd like to talk about, then please leave a comment below. Let me know how you're going. Don't forget to like and subscribe, tell your friends, share the videos, and I will see you next time on From Ed to Med.